Officers have what's called standardized field sobriety, which is the walk and turn. It's where you walk heel to toe 9 steps, turn around the line, and come back. One leg stand, where they raise their leg up and they count or estimate 30 seconds.
So this is testing physical abilities.
Physical abilities on the street. Officers also use distinct nystagmus, which is what they look for the eyes. The eyes will sit there and twitch. There's a special way that they'll follow a focal point. Most likely it's a pin or an officer's finger, and you'll see the eyes twitch. Certain drugs will indicate that, certain drugs won't. The biggest thing is just the officer's own observation and past experience by either odors and behaviors is one of the big ones that the officers will key in on.
Well, knowing what to look for in nystagmus tests can be difficult, and we're going to show you a video from the National Highway Traffic Safety Administration, and we think this may help.
Keep flowing.
Of the field tests available to a trained officer, the horizontal gaze nystagmus, or HGN test, provides the clearest and most distinct clues. Nystagmus is the involuntary jerkiness of the eyes. There are many different types of nystagmus, each with its own peculiar characteristics. Normally, this jerkiness is not visible to the human eye. However, when a person consumes alcohol, the eyes are unable to maintain visual fixation while moving side to side. The eyes appear to slowly drift away from the direction of the gaze and then quickly jerk back. This observable phenomenon is known as horizontal gaze nystagmus and is what trained police officers look for when conducting a field sobriety test of the same name. Here we see an alcohol-free subject being tested for horizontal gaze nystagmus, or HGN. The eyes are following the moving object smoothly. There is no jerkiness at any point, including at the farthest sides. Graphically abstracting the eyes emphasizes the smoothness of the eye's pursuit as they follow the moving object. Now look at the differences in those same eyes after the subject has consumed enough alcohol to be impaired. These eyes have difficulty pursuing a moving object smoothly. There is a distinct jerkiness at maximum deviation.
Okay, well, you definitely have to have some training to see that and to know what you're looking for and what it can mean. Now, nystagmus, does that also occur when somebody's using a drug as well as alcohol?
Certain drugs, yes. Certain categories of those drugs, you can see nystagmus show up. One of the key words I wanted to point out was they said distinct nystagmus. People's eyes who've seen this or have seen this video will go out and try it, and you'll see the eye twitch when you go to that maximum deviation. But that's the eyes
to the one side or to the other.
Right, and that's going to be normal because the eye's going to try to focus. What we're wanting to really look for is if that eye keeps doing that, bouncing back and forth. That's distinct nystagmus. But
and that's a clear indicator of somebody on alcohol, a drug?
Alcohol, depressants, some inhalants, and then also the dissociative anesthetics, the PCP, the ketamine, and DMX. Some of those will show some of those.
So those 3 categories would be associated with somebody who is having that with the eyes, and you could place them into that category.
It would be one of the indicators for those categories.
One of the indicators. So there's other tests to give to them. There's
several. We can't. If we're going to go with the drug category, we cannot just take one indicator and say, okay, it's got to be one of these 3 or one of these. We have to go through a whole series of those tests, which is blood pressure, pulse.
So you wouldn't just stop at the nystagmus test and say, well, they failed that, they must be on one of those drugs or something or alcohol. So it could be a natural problem with them. So you have to rule that out. You have to do other things.
Correct.
Okay. Can people fake these results? Can they fake what's going on?
Well, not if the tests are performed correctly. The nystagmus test, there's a lack of smooth pursuit in the eyes. That's one of the indicators that we look for. The second indicator would be distinct nystagmus at maximum deviation. And then the third indicator would be distinct nystagmus at 45 degrees, which is about the shoulder, the angle for the shoulder. I have seen them fail or fake the maximum deviation and successfully do so. It was pointed out to me, I had gone years of doing field sobriety tests and looking for nystagmus and did not realize until it was pointed out to me by a friend of mine who had faked out field sobriety just to show me that he could do it. And basically on the maximum deviation, it's way out here, okay?
And you keep the head straight.
The head straight.
Okay.
If a person is looking at not looking at the stimulus, which at this point is my finger, they're looking at a fixed object. To me, as the administrator of the test, it looks like they're looking at my finger, but in fact they're not. I'm not getting their eye.
They're focused somewhere in the distance, somewhere
in
else.
the distance, and their eye is not maxed out. So I'm not seeing maximum deviation. I'm not seeing any deviation because their eyeball is not focused at the maximum point. And in turn, I may not pursue a DWI by drugs or alcohol based on that test.
Because they've learned how to get
That's
around
correct.
it. So